Hi there, welcome to our first recorded video. I'll be doing a lot of these recorded lectures throughout the semester. My goal, although not my promise, is to get them around 15 minutes or less. But with that shortened lecture time, my expectation is that you're going to fully engage with the assigned readings, the assigned videos, that you'll take your time to pour over the lecture slides. But I don't want to be talking at you forever and ever. Amen. So here we go. Introduction to Public Health. I have this quote on our front page of our Canvas course, and ultimately this is my goal for you in this course, that you will develop a more open mind and a more open heart. Public health is about expanding your horizons, about thinking of health outside of the hospital, outside of individualized patient care, meaning just one-on-one, but that you're looking at taking care of the health of communities, of populations, that you're thinking big picture about healthcare systems, and that you're expanding your heart to pay attention to those who often get forgotten or overlooked or not treated well within our healthcare system. We call those people vulnerable populations. That may be a familiar term to you. We will do a huge section on vulnerable populations in this class, and so that is where I want your heart to also be opened as well. So I have this slide here. You may press pause on the video. This may be a good time to just stop and think, what do you think public health, what public health is? What comes to mind for you? It might be helpful for you to pause this video, and if you're with some roommates, some nursing majors, some non-nursing majors, a family member, ask them, what do they think public health is? Obviously, it has come much more into the forefront of our language and of our awareness as a country and actually the whole world because of our pandemic. But before this pandemic, public health could be easily forgotten. We will continue to explore more on what it is next week in clinical orientation, but I want you to be just exploring. What do you think it is? What comes to mind? So the World Health Organization and the National Academy of Medicine, they used to be referred to as the Institute of Medicine, IOM, that's listed as a reference at the bottom. They're now NAM, National Academy of Medicine. So that is our major national government organization that is devoted to all kinds of things related to healthcare and medicine. And so they put out these excellent definitions of what health is and what public health is. I think this really resonates for a lot of students. It certainly resonates with me. Most of your focus has been on physical or biological well-being of patients, but really I want you to get way beyond that. We're going to be talking about the mental health needs, the spiritual health needs, the social health needs, and that health isn't just having physical well-being, but it's having all of those aspects of well-being, and it's not just the absence of disease, injury, or illness, that we're looking at ultimate or optimal well-being. And to just further explain that, I want to be clear that sometimes you can have well-being in these areas in the presence of disease, in the presence of great illness or injury, right? I know you have seen those cases of incredible amounts of internal resilience. And so it's not even about the absence of disease and illness. It's about achieving well-being regardless of those other circumstances or things that we may not be able to control. And then public health is taking that definition of individual health and applying that collectively to groups of people. And so what can we do as an entire society to make sure we're offering conditions that allow people to have their optimal physical health, mental health, spiritual health, social health, relational health? So what can we do to set people up for that as a society? That is the ultimate question of public health. Public health in America, I have a description here of kind of how this came about in the 90s, the vision for kind of really describing what public health is here in America. There's our vision and there's our mission, and I just encourage you to read this here. Public health does all sorts of things. We'll be talking about these in more detail throughout the semester. Obviously, preventing or managing epidemics or pandemics, right? And so epidemiology and communicable diseases is a major portion of our course coming up soon. Our goal is to look at environmental hazards. That could be natural disasters, that could be unsafe drinking water, that could be things like polluted air quality, that sort of things. We want to prevent injuries. So something as simple as safety or seatbelt laws and car seat laws are a part of public health because they prevent injury. We encourage healthy behaviors. So for example, right now that's wearing a mask and social distancing, but in general, it's eating healthy and exercising and maintaining positive connections with others and that sort of thing. Public health response to disasters, and obviously the disaster right now is a pandemic, but there have been other disasters. I'll go over a few in a minute. And not only assist in the immediate aftermath, but help communities find recovery, which often takes many years after the initial disaster. You can imagine that our economy and the mental health of many people in this country it's going to take years to recover from this. And then public health assures the quality and accessibility of healthcare services. So we are thinking about those vulnerable populations, those uninsured or underinsured people, and how they're able to access healthcare, because public health does argue that public health or that healthcare is a right and not a privilege. I'm not going to talk too much about all these, but you can see that there have been some recent health threats or events in the US. COVID is not on here because this slide deck was actually mostly put out by the CDC a few years ago, but that would certainly be top on this list. But you can see, I just have this here for you to see the different kinds of health threats that we have experienced: hurricanes, foodborne disease outbreaks, such as salmonella in peanut butter, so all sorts of things, right? And then 9/11, so the terrorist attack as well. So you can flip through here. I want you to look at these or at these different kinds of disasters and public health threats and think about, as you read this, as you read about the physical damage, as you read about the economic impact, I want you to be thinking about what might the health needs have been in those communities that were affected? What might the physical health needs have been? The mental and spiritual health needs, the social health needs. So again, I want you to be thinking about that in a holistic way. 9/11 was hugely instrumental in kind of helping us better coordinate our public health and safety efforts as a country. And so after the 9/11 attacks, first of all, the Department of Homeland Security was formed so that we were really able to kind of develop a more proactive as opposed to a reactive stance on caring for ourselves in regards to external threats and attacks. But also 9/11 prompted a huge coordination from a national level all the way down to a county level, so that when any kind of disaster happens, whether it be man-made or natural, that there is a unified front, that there is a plan in place, that there's a system, a command system set up, so everybody's kind of working together to coordinate supplies, to coordinate personnel and that sort of thing. As you can imagine, this has broken down a bit during this pandemic. We'll talk more about that later in the semester when we cover the disaster management portion of the course. Curious what you think. Again, pause the video, talk to a friend, roommate, family member, see how many top 10 causes of death you can come up with on your own in the US. Pause, go. And here they are. See how many you got right. I'm going to ask you in our next class how many you were able to get right out of these top 10. Unfortunately, the number 10 has been the most recent addition to this list, and that is intentional self-harm. Yeah, so mental health is a huge piece of public health. There you have it. Public health, well, let's start with medicine. Saves one life at a time. Right? Individualized patient care. Public health is looking to save millions. And that's exactly what we're trying to do with this global pandemic, with our health promotion, our health education, our coordination of services. We are trying to do everything possible with the vaccine research, right? We're trying to do everything possible to save millions of lives so that this doesn't continue to kill millions of people. Thanks to public health efforts, we have been able to identify that our life expectancy, specifically related to public health efforts, has gone up 25 years. Can you imagine? So back in 1900, people were only expected to live to 47. I'm getting close to that. And now it's 78.6. That's the most current number I have. When we start talking about our healthcare system compared to other first world healthcare systems around the world, it's a fascinating topic we'll get to later in the semester. Unfortunately, 78 is pretty bad compared to other first world countries. So we still have a long way to go, but we've come a long way thanks to public health. Again, pause the video. What do you think might be one of the 10 greatest public health achievements in the last 100 years? I've mentioned a few already. Here they are. Vaccinations, we're going to need another one, right? Quickly. Workplace safety, right? Especially with all of the industrial jobs that were much more prominent in the early 1900s. Having more access to healthy and safe food. So being able to monitor that sort of thing. Obviously, motor vehicle safety. My mother always likes to tell me that when I was a baby, there were no, well, maybe not obviously to you, but there were no car seats and no seatbelt laws. And so I would just get put in a bassinet and they would just set me on the back seat of the car. Crazy, right? We have been able to majorly control infectious diseases. So I'm going to actually post the PowerPoint. I'll usually post PDFs of my lectures, but I'm going to post the PowerPoint here because the lecture notes here under this PowerPoint slide are really, really helpful to describe exactly how much progress we've made with these 10 different areas. And so I really want you to read that and kind of get an idea for the overwhelming things that we've done in public health. And fluoridation of drinking water, right? That would probably never be on anyone's top 10 list, certainly not mine, but that has been a huge thing as far as our dental health goes. And we know that dental health is connected to cardiovascular health, and so even more of an important thing. So there is a framework that we will continue to talk about in clinical orientation next week. But what I want you to know is that public health essential services, this is for all public health specialties, so not just public health nursing, but they are broken up into 10 services and 3 domains. So 3 domains which cover the 10 services. And the domains are assessment. So are we assessing our community? Are we developing policies to protect our communities? And are we assuring that adequate, proper healthcare is being given? This was developed by these details here. And these are the 10 essential services of public health. We will continue to come back to this over and over and over again. You're going to write a paper later in the semester addressing these. You'll talk about these in your journals for clinical. I really want you to be very familiar with what these are, what they mean, how they apply to the different things that we do in public health. So we'll talk more about that at clinical orientation. I will refer to it as the wheel. If you're a visual learner like I am, this is a great way to look at it. And so all 10 of these are listed around this wheel here with the domains on the outside. And look what's in the middle. Surprising or not, I'm not sure. I'm happy to know that research is in the middle, that everything we do in public health is dictated by the best evidence. And then you can just go around and see all the different examples of what that looks like, right? Public health system is made up of so much more than what you might think of a primary care clinic or the county health department. County health department is certainly kind of at the forefront and running the show, and that's what shows in the center here with public health agency, but all different sorts of services are involved: nursing homes, mental health, home health, faith institutions, especially ones that provide parish nursing along with spiritual care. Hospitals are certainly there because we have to refer to them a lot. Law enforcement, keeping us safe, just layperson neighborhood organizations that are all about building up the communities and connecting people to resources. Fire, we're going to be involved in that this semester, right? They're a huge service to the community. So just take a look at this and see what you think about all the different people that play a part in the public health system. This is just another view of the same thing, kind of putting it into specific categories as opposed to agencies. And then if you're curious about what public health departments, local public health departments, so for us that would be San Diego County Health and Human Services, what do they do? What do they spend most of their time doing? And most of the time, outside of epidemics and pandemics, which are disasters, they provide immunizations. They monitor for communicable diseases, particular ones. We'll talk more about that soon. They screen for TB, and the list goes on and on. I love this quote from, again, the Institute of Medicine, who is now called the National Academy of Medicine. They say that the determinants of health are beyond the capacity of any one practitioner or discipline to manage. We must collaborate to survive as disciplines and as professionals attempting to help our communities and each other. Now, more than ever in this global pandemic, we need to collaborate. We need to trust our scientists. We need to trust our public health professionals that we are all doing the best we can with the best evidence we have right now. And as you know, the evidence is changing almost weekly for COVID, but we really need to work together to ensure that our communities are educated and that they are given the proper policies and mandates to do what we need to do to keep each other safe, and that we are working to collaborate together on research efforts, which has been a monumental thing across the globe, the way that research scientists are sharing their data and their information so that we can get to a vaccine as quickly as possible. It's pretty remarkable what's happening worldwide in that respect. So lastly, I want to just identify your assigned article that goes along with this lecture for the middle of this week. I'd like to have you have read this by Friday for our Friday class, and that you will be quizzed on that over the weekend. But these are the questions I want you to be asking as you read this article. It's a fascinating article that highlights Texas and why in particular some of their public health departments feel that they're losing the battle with COVID. And it's just, I assigned this article because it does a really great dive into kind of some of the history of public health, of our public health system in the US, some of our achievements, some of our failures, some of the problems that exist that kind of keep us hindered from doing what we need to do with COVID. And so I want you to be thinking about these things as you read the article. How has public health changed over the last 200 years, for better or for worse? What are the problems currently that are identified as undermining our success? And then what do you see? I want to talk about with you, what do you see as the biggest threat to our public health system, especially in relation to the pandemic? I got a whole lot of thoughts on that, but I want to know what you think about that. So that is the end of this lecture. Look forward to being with you soon.